Oh, we're live. Hey.
Okay.
So, Dr. Sarver, I'm Brad Goodman.
How are you?
We
Nice
just
to
met. I appreciate you coming on to Doc Talk Live. Doc Talk Live is basically Facebook Live.
Yes.
But it's about anything that's healthcare related, medical related, and you've been practicing orthodontics for how many years?
37.
Too many years to count, right?
No, I can't remember.
And I'm aware that you travel all over the world teaching orthodontics, and you've written books on the field. So I really appreciate you taking the time to let our viewers sort of see this, and hopefully over the months they could see more. But you just pulled up a case just 5 seconds ago, and I didn't want to talk about it, but I thought that would be a great place to jump in.
Yeah.
Because you said this person was from Europe.
Yes.
And she was in a car accident.
She actually got hit by a car.
Hit by a car. And what happened to her? Tell our viewers what happened to her.
Well, this young lady was out jogging in Paris, France, and someone wasn't watching where they were going, and she didn't see them coming, so she got demolished by a car. Now, she was hospitalized for several months. Probably by the time she got to me, about 6 weeks after the accident. And
how does somebody from Paris, France, get to you?
Well, she grew up in Birmingham.
Okay, so she did have a link here.
She called a local dentist and said, "Come here." Actually, the magical question is, how did she end up at the orthodontist? Okay, because if you look at this, right there.
So what are we looking? I mean, obviously this is a
very
deformed area.
That doesn't look like your normal set of teeth.
No, exactly.
All right, and what happened was,
and I can assume they can see that. So I see it right in the middle of the screen. So I'm hoping they can see it.
Let's blow it up.
Okay, and I could also move this a little closer, probably.
Yeah, there you go.
Might be a little shaky, but
all right.
That's good.
That's better.
Yeah.
All right. So what happened was, she got hit. And she's not quite sure what all happened. But as part of the process of A, saving her life, and then B, putting her back together, she was in the hospital for a couple of weeks. But whoever did all this, that's all they could do. They had bigger fish to fry.
Sure.
All right. So they had a dentist come in probably and just put all this glue on there, just to hold the teeth in place.
So that's what this is it's glue.
Yeah.
Okay. And the bottom teeth look pretty good, actually.
Yeah. She'd had her teeth straightened before. So she was mostly that problem. But the challenge of this case then becomes this, that what's under there? Like normally you would look at that and say, that's gone, that's wrecked, or is it? Are the teeth broken? Are they salvageable? So many things. But most of us would look at it and say, okay, an oral surgeon's got to remove all that damaged tooth material, and that takes a bunch of bone with it, which then would require bone grafting. And for a defect that size, it would be a number of really complicated procedures.
Sure.
Followed by implants and crowns and all that.
Okay.
And so when we look at the 3D film, and what that shows me then, and probably what would help, would be to cut the overhead light off.
It's a good idea. Let me see if I can find that.
Yeah, it's right there.
There it is. I got it. Perfect.
Okay, now you can see that, and it may not be as clear on this. Yeah, it's pretty clear.
That is pretty clear.
Yeah. What I can see is that, let me change some of the
and I'll just move the camera closer to it.
Let me change some of the density on it. Okay, so that with this I can see, for example, the pulp of the tooth, and see whether there are fractures and that sort of thing. So when you get here, you see that part of that tooth has been fractured off. All right, and so you see that big space up there. What that represents is where the tooth has been dislodged. All right, so they are completely outside of the bone.
I'm going to pull this back because it's going to be hard to sit still on, but okay.
All right.
But I think our viewers can see that pretty good.
Yeah, well, they get the idea.
Okay,
anyway,
yeah.
That All right, so that before I do anything, I want to know what's under there, and then we can go.
So this is a special. It's a 3D CT, 3D X-ray. What is this?
It's what I call the cone beam CT. It's not medical CT. Is helical CT.
Okay.
And it's a much higher radiation exposure.
This actually is a lower radiation.
Yeah, and for two reasons. One is the technology itself, but the other is the fact that it's focal field. In other words, actually, I was the one that led. I'm a consultant to Kodak and led them to this idea that I'm a dentist. I just want to see this part. I don't want to know what's in the cranium.
Exactly.
I don't want to know all that.
Right.
Okay. I just need to know this area.
Got it.
And so what you get then is, the right amount of radiation for the diagnostic application.
Gotcha.
Okay. And so when you can walk through the slices just like you would with any CT, but you can see that the teeth are completely outside of bone. All right. So the reason that the dentist said go see the orthodontist is because that at least gives her some options on how to salvage these teeth.
Okay.
All right. And so this view right here does a good job of kind of showing.
So she's in a car accident. Her upper teeth are messed up. You get this special CT, the special image,
right.
And you see that there are teeth here.
Yes.
In the bone, and it gives
yes.
her options.
Right.
Which allows you to actually be creative.
Yes.
In terms of what you can offer her.
Right.
So what's going through your what's
okay,
the plan now?
So this is, I'm actually using her as the introduction to a new book that is Diagnostics is Thinking Your Way Through the Problem.
Right.
Okay, and so the first question when I saw her teeth was, oh, what's under there?
Right.
What have I got
right.
to work with?
Right.
So when I look at this, I go,
it's like an iceberg. You see
yeah.
like the tip of the iceberg, but
yeah.
you don't see what's in the water.
Right. So here I know I got a whole tooth under there.
Right. That's awesome.
But it's outside the bone. All right. So most people would think, well, that tooth has had all its blood supply lost and so forth and so on. But she's got collateral circulation. Teeth aren't just going through one canal. They have lateral canals that are connected blood vessels. So the teeth weren't dead. They
okay.
weren't going to die.
Okay.
All right. So here's my main mission. All right. So what is the reason for me doing anything? The reason is for me to first put the teeth back into position if I can.
Uh-huh.
Number two is if I can't put the teeth back in position, at least by keeping the teeth in the bone for a time period, I can save bone. I can actually create bone by moving the teeth, and how the periodontal ligament is attached to the surrounding bone actually generates bone as I move it.
Okay.
Okay.
So you're going to move the teeth down? Is that what you're going to do?
Well, I don't know that yet, because what I don't know is, can I get the tooth back in the socket?
Okay.
All right.
All right.
My first thing I'd like to do would be to put the tooth back where it started.
All right.
All right. The second thing would be, okay, if I can't get it there, or it, isn't ideal, I can start to extrude it, and it creates bone that fills in, and you don't have to have the bone graft, or you minimize the bone graft.
Okay.
Okay.
So can you show us some before and afters of things you did with her?
Yes.
I'm sure you can.
Yeah, absolutely. So let's go to here. First thing I did was I took a diode laser and I uncovered the teeth, because you had all this inflamed.
Wow.
Yeah, you had all this inflamed tissue.
Okay.
All right, and I can't, as an orthodontist, put anything on that.
Uh-huh.
All right, while it's bleeding like that. So I, with a diode laser, went around and cauterized and excised tissue, all the extra tissue that was inflamed. I took it off, and with the laser, it cauterizes and sterilizes,
Gotcha.
so that I've got a very clean field, and it doesn't bleed, which means I can then attach brackets to it. So this is all in the same day.
Okay.
She's come in. I've gone through what happened to her. I've removed the plastic and all the stuff. I've seen what's sitting under there, and I didn't, I went through what I saw, because I'm looking at that, like, how am I going to handle that?
Right.
But when I uncovered the teeth, even, you remember the one tooth that looked like the crown was broken off?
Yes.
There was a piece of enamel still left.
That's awesome, right?
That's
a good thing.
Because I can grab it.
Exactly.
And
okay.
move it down and create bone.
Okay.
All right. So that is the first day. So I put brackets on there and I put an arch wire in and start moving the teeth. And see where I've even put a little button up here on, well, you can't see it. I've even put a button up here on that remnant of enamel, which is still attached to the root of the tooth.
Right.
So for us, the important thing is not so much the crown, it's the root. Because the root is what is attached to the bone and creates bone or it takes away bone. That's how orthodontists work. I push a tooth, it takes away bone on one side and adds it on the other.
Got it.
All right, so we're just using basic physiologic principles that we all do every day.
In orthopedics, there's something called like an
Distraction.
An Ilizarov procedure where they lengthen the bone.
Yes. Yes.
Okay.
We have the same thing in our field. We actually, like on cleft palate children that have, a repaired palatal, repaired palate, which is scarred. So if and their maxilla hasn't grown, a lot of times we'll move it forward with a halo, like the neurosurgeons
Yes,
do.
yes.
A halo, and what I'll do is I'll have attachments on the teeth, and we gradually bring the maxilla forward incrementally over time so that it maintains blood supply as it moves.
Got it.
So that is an adaptation of the Ilizarov procedure to faces and jaws. Okay.
This is one of the things I like about shows like this is I get to cross-pollinate with other people. Like, okay, because we could start talking about stem cells and growing bone and PRP, but I don't want to get too distracted. Let's continue with this case.
And then you're getting kind of out of what I really know. All right, so
good.
Right,
let's stick to this.
Let's go back
to this.
Right. All right. So over time, then this is the next week. All right, and tissue is healed.
Wow.
Teeth are moving. This is let me see that.
So you're trying to move these teeth down? Is that what you're doing?
Yes.
Yes. Okay.
All right, and then this is 2 weeks.
And then behind it, bone is forming.
Bone is going with it.
Gotcha.
All right. So here she is after 3 weeks. After that first visit.
Show them the before again. Can you go before and now? Before and now, like scroll back and forth.
That is 9/16. I'll do this.
That was where we started.
And let's go to 9/16. Center.
Yeah, I'm gonna move this closer so people can see.
Okay.
And I'll hit the button. Okay. Can you see it?
Yeah.
Good. Okay, I'm gonna move it back.
Okay, that's in 3 weeks.
That's amazing.
And so if you look over here, you see how much bone
is forming.
It's forming.
Yeah. So you're actually lengthening the teeth.
No, I'm not lengthening the teeth. I'm bringing the
You're
teeth
bringing the teeth down,
and the bone is following.
Oh, gotcha. Okay.
Okay. So that's we're winning so far.
All right.
All right. Now let me see. That's another 3.
So after I see this, I'm going to think there's not a mouth you can't fix. You can't straighten out.
Well, here's the other thing that I ask myself is, okay, 99% of us in the dental business would say you got to go see an oral surgeon and have all that traumatic, the material removed. But the dentist just went, let's at least see if there's another option. And so he's a prosthodontist, and he knew that it's common for us to move teeth to prepare bone for them to do implants. Okay.
So he was shrewd enough to know that maybe there are some options here.
As they said in Dumb and Dumber, which I am, is you mean there's still a chance?
Yeah.
Okay.
So you're saying there's a chance.
So you're saying there's a chance. All right. So that was,
I can relate to that.
Right. So that was kind of what he was thinking was, okay, there's a chance.
All right.
All right. So I looked at her and said, okay, if I get involved in this and I think I can do what I can do, what's the worst thing that happens to me?
Yeah. What's the downside?
She loses all her teeth and gets a bone graft,
which she was going to lose anyway.
Yeah. So you got really almost nothing to lose.
Right. It's a no lose situation. That's one of the things I like about my specialty too. But that's for another day.
Okay. So let's go on down. I'm going to close her 3D because I can't open them more than one at a time. All right, so got her down to She moved back to Paris, and I referred her to a person I knew. She came back for us to repair her fractured nose, so I got these pictures, and so there she is. The orthodontist actually didn't listen to me, and
he extracted 2 teeth.
Yes. I don't know why. I've asked him because I want complete records. I don't know if they, we might have not have taken them out.
All right.
So this patient I treated between New York, Paris, Atlanta, and Birmingham.
Okay.
All right. So she's all over the dang place, and I'm trying to.
What does she do? I'm sorry, I probably shouldn't ask that. That's all right.
She's in design. All right. So and she's very. All right. So anyway, he put the brackets on where I would not have put them.
I want to be between New York, Paris, Atlanta, and Birmingham.
Yeah, that ain't a bad job. All right, but what if you can see that what happened was he pushed the teeth back up.
He's going the wrong way.
It's going the wrong way.
It's going the wrong way. Maybe gravity is different in Paris.
Well, it may be that well, everything's different in Paris, for crying out loud. All right, so I was able to finish her off, and then I had her.
That's good.
Yeah, that's after I took those brackets off and I put them back on in a different place, and so that's not going to be stuff you care to know. So there she is. I've now put the brackets back in the right place.
Did you implant teeth in those areas that
those
were
are
gone?
plastic teeth.
So those are fake teeth.
Yeah.
This tooth and this tooth is fake.
I put a bracket on a plastic tooth and put it onto the wire.
Okay.
Because it was funny to me that, okay, she's in Paris walking around with 2 front teeth missing.
Okay.
And she moves to Alabama. I go, even in Alabama, we like to have front teeth, So I put her some teeth in there.
I think it depends on what part of Alabama. But
yeah,
whatever.
yeah. Well, I'm from Auburn, so that tells you a lot right there. All right. So here she is, just looking at this. There, they went ahead and did root canals also. I don't know if she needed them or not.
I wonder if they can see that. Yeah, I think they can see that.
Yeah.
Okay.
The white line is a root canal.
Okay.
All right, and the guy won't return communication, so I think he's probably wondering what I'm asking him for and whatever. So I had her restorative done in New York City because that's where she was living, and I researched someone, and that's her.
Wow. Now, talk to me about this stuff. This looks a little prominent to me. If I had to be critical.
I would be critical. Actually, let me show you one of the things that I consider pretty important is the aesthetics of the teeth. The teeth, and I hope that guy that did them isn't watching, but then he probably should be. This is a program I've created for this company here. And if it will act right, and it seems to be taking its time. There. All right. What you can do is, I like to say, look, I'd like to visualize what if these teeth were not as long as they are. That's what you're seeing, is the teeth are disproportionately long, and it would be nice.
Yes.
Better.
Yes.
Right.
Exactly.
So had I been intimately
could they see that? I wonder if they could see that. Let me
blow it up again.
It could just be the camera.
It's this glare causing.
I wish they could see that. Let's see if I move it closer. It's so bright.
Yeah.
What if I turn it around? Let me try that. Let's see if I turn it around. No. I'm not going to be good enough at doing that. There's some way to flip the image.
Yeah.
That's
Whoa,
good.
There
That's
you go.
good. Do that again. Show them that again.
Okay. All right. What I'm going to do is move it back up to where it was.
Yes.
All right.
Yep.
And then move it back down.
Right.
That's the ideal size of teeth.
Yep.
All right. Now, it's like every endeavor. Some people have an aesthetic eye, just have an artistic sense.
Right.
And others don't.
Okay.
Some of us as dentists are mechanically and scientifically good, but we don't have a good eye for aesthetics.
Okay.
So that I would say that excellent clinician with not a good eye for aesthetics.
Okay.
All right. So I would have guided, if I'd been working with a prosthodontist who sent her to me, we would have interfaced with each other, because that interdisciplinary communication is pivotal to get what you want.
That is a fascinating case.
Yeah.
So really, really interesting. I think that's a great way of sort of, letting our listeners sort of see like what challenges. So, are you seeing a lot of adults who just come in to want to get their teeth straightened? I mean, that seems like a chip shot now after looking at this case.
Yeah. Well, 40% of my practice is adult. But with some of the books, I've written books on jaw surgery and stuff like that, so I have a greater load than most. The average orthodontist has about a 25% adult population. Because adults, now that they know that it's never too late.
It seems like more and more adults are getting their teeth straightened.
Yeah.
And how long is that process?
Oh, it depends on the problem, just like anything
I'm going to turn the light back on, because
Okay.
I'll just let you look at my teeth. Now, I am not about to get my teeth. I'm not about. When I was a kid, I feel like I've had braces forever.
Well, that's what most kids do.
I think I started at 6, and I think I got rid of them around 12.
Yeah.
Maybe 14. It just seemed like they were on for years.
Yes.
So they're not really perfect at all.
All right, so when we're talking about proportions of teeth, your front teeth are worn.
So let me tell you about that. So I played hockey as a kid, and we had helmets, but we didn't have face masks.
Right.
So I would chip my tooth,
And they
would just file it off.
Right.
So I lost, I got these really short teeth.
Right. Well, as a topic like that, one of the things that we do is interface with the prosthodontist for me to orthodontically get the teeth positioned so that you can have veneers done to restore the length, so that when you smile, you've got a nice big smile that looks like you're a sportscaster.
So how long is this process going to take me to get?
Probably a year.
Yeah.
Total. Yeah.
Another year. And so what would be involved, just so our viewers can sort of capture what's involved here?
In cases where the teeth are fairly well aligned, you can do Invisalign, which are the clear aligners, which are not braces. You would know the name Catherine Webb, who married the quarterback for Alabama. She was a Miss Alabama and then became famous.
Okay.
Well, I was treating her with braces on the backs of her teeth. And so she was on TV and doing Good Morning America.
But what would be involved in me? What would I come in, and what would happen? What would be the
what I
process?
would do? I would be too. And let me illustrate this with this. Your teeth have erupted into each other because they've been wearing, and it's like a rat's tooth. It's going to keep going. And so I would move these up and these down and make room for the dentist to add veneer material or crowns to restore the height of the teeth and have a good bite.
I see. So you would move the tops down, the bottoms up a little bit with...
No. Tops
down.
Because when you smile big, I see gum.
Yeah.
All right, and the teeth are uneven.
Okay.
So I would make sure that I get the gum lines even, matching your upper lip. And then the veneers would be done to add length, which means I have to move the lower teeth down so that you're not banging on your lower teeth.
Okay, so what are veneers? I don't really know what
veneers are. A lot of people refer to them as porcelain shells, where what is done is the dentist takes off a little surface, about 1/4 millimeter of enamel, and has a real thin porcelain material. And they've got materials now that are extremely strong, durable, and aesthetic, that they can then restore without having to cut down the whole tooth and make a crown.
Okay.
And so they've grown in popularity because it doesn't just wreck your teeth to achieve an end. It doesn't have a margin, which a lot of people you see with crowns on their front teeth. You see a little gray along there. Okay, those are old crowns that are kind of showing through because they got a margin, which is where bacteria can accumulate. All right, and with veneers are done right to the margin where it's cleanable. So it feathers in with the tooth. Now, I don't do them myself, In a lot of cases, I wish I did, but anyway.
What's the most rewarding part of what you do? Is it the kids that now can have this big, bold smile? Is it the restorative stuff?
Well, I think it's probably like your profession. There's a lot of things that are really, you take home and go, okay, I done good today.
That's awesome.
Yeah, and so I can show you maybe at another time.
That'd be good.
Jaw surgery cases that you would be.
I love the idea of looking at cases where we can go through on the computer and people can see it from from start to finish.
Yeah, yeah.
Just a few more questions. What is dentofacial orthopedics? How would you define that?
Dentofacial orthopedics. When you and I grew up, if you had a lower jaw that wasn't growing very much, and you didn't have a chin, and you had a big overbite.
Mm-hmm.
When we grew up, in my generation, it was common to pull teeth and move the upper teeth back. In other words, you weren't paying attention to the face. And so you would have people whose jaw's back here, and you move the upper teeth back, and those are people who look like a porpoise, or a torpedo. All right. Nowadays, we can do things like what we call growth modification, where we time treatment to match when a child is hitting a growth spurt and can actually help their lower jaw come forward, not pull teeth, have a stronger profile, in other words, better looking face, teeth that fit, and accomplish the same goal.
I feel like they pulled a ton of teeth when I was a kid, too.
It was a lot more common when we grew up.
Oh, my. Pulled a lot of teeth. Well, Dr. Sarver, thank you so much. This was fun. Let's keep doing this. This was fascinating.
All right.
Appreciate it. Share this with anybody you can share it so we can grow this program. Thank you.